Tattoo artists must be fully aware of the potential dangers of their procedures and how to prevent infection. Tattoo artists and body piercers must follow health and safety practices and clean technique to protect themselves as well as their clients from bloodborne pathogens and communicable diseases that include viruses, bacteria, and fungi. A tattoo is done by injecting ink into the dermis, which is the inner layer of the skin, with a needle attached to a handheld tool where the needle is vibrated up and down at a rate of several hundred times per minute. Infection can be spread through unsterilized equipment, contaminated ink, not handling needles correctly, and improper cleaning of surfaces or the client's skin prior to the procedure. Bacteria, viruses, and fungi can be present on the skin of the person receiving the tattoo or the piercing. And when receiving a tattoo or piercing, the needle pierces the intact skin, where germs on the skin can contaminate the needle or ink and can become a source of infection. It is important for a body art professional to use aseptic technique for tattoos and body art. Aseptic technique is used to prevent cross-contamination. In other words, prevent the transmission of germs from one person to another or from one place to another. Visible blood on surfaces, instruments, or needles is not necessary for infection to be transmitted. When working with a client, all surfaces and used equipment needs to be considered contaminated. The goal of using aseptic technique is to protect the body art professional and the clients. Aseptic technique includes the following principles. The body art professional needs to cover his or her own skin that has wounds, infections, or dermatitis. Also, clothing needs to be clean. Don't let used equipment come in contact with clean or sterile equipment. Maintain the cleanliness of all supplies by storing it in a manner that's sanitary and protects all items from contamination. Be sure to use barriers like single-use gloves and gowns. Use proper hand hygiene. And when wearing gloves that potentially have body fluids on them, do not touch other items. Remove the contaminated gloves before answering phones or adjusting light fixtures, picking up clean ink bottles, or getting supplies out of storage. Before giving tattoos or piercings, properly clean and prepare the client's skin with a skin antiseptic. There are many different antiseptic skin cleaning agents. Make sure to follow the manufacturer's directions and the specific antiseptic you are using, how it's supposed to be used, and its proper application. Ink shall be from a single-use container and only used on one client. Ink stored in bulk containers can be transferred to single-use containers. Dispose of single-use containers after each person. Use disposable single-use needles and follow safe injection practices. Immediately dispose of contaminated needles, dressings, disposable gloves, and other disposable items. Maintain a clean and sanitary environment by using a proper disinfectant. Disinfect your chairs and work surfaces between each person. Remember that reusable tools and equipment must be cleaned and sterilized. Sterilization machines such as autoclaves must be regularly tested and serviced. Needles, scalpels, or other sharps that have contacted skin or body fluids shall be placed in a puncture-resistant closed container. Sharps disposal containers must be kept in a safe place that is easy to reach, clearly marked, and changed when they become full. Remember, these are general guidelines to help protect you and your clients. Each workplace must have a written exposure control plan that outlines the proper procedures that are specific to your facility in regards to proper disposal of regulated waste, use of engineering and work practice controls, and the proper use of personal protective equipment. Pro Trainings has a great way to create an updatable and electronic exposure control plan online. Check out the website for more information.